Hello, my name is Cameron Adams. I am a second year internal medicine resident at NYU in New York City. I'm here to present my poster titled Alcohol Related Liver Damage Can Be Reversible. This poster focuses on alcohol associated liver disease, if it can be avoided, and if it is reversible. So, we know that alcohol can damage your liver and it can do so temporarily or permanently. Some individuals have pre-existing conditions such as metabolic dysfunction associated steatotic liver disease and or viral hepatitis that leaves any amount of alcohol consumption likely to leave lasting damage. But for most of us, it leaves damage that can improve. When you go to the doctor, we ask you how much alcohol you are drinking. Because it comes in so many different shapes and sizes, to understand your consumption, we're often talking about it in terms of 30 grams of alcohol, which I've labeled here in this box. The other thing that we may do at a office visit is we may measure your liver function tests. This is just a fancy word for enzymes that we know only exist in your liver. So when we measure their level in your bloodstream, we can tell how much is leaking out, and that gives us a general idea of ongoing liver damage. There's a spectrum of different ways that alcohol may impact your liver. If you are just starting to drink alcohol, you may get some fat deposits within your liver. Subsequently, this can lead to chronic inflammation in a condition known as alcohol-associated hepatitis. As this inflammation continues, you get scar tissue that lays down in your liver in a condition known as cirrhosis. And this condition of scar tissue in your liver can lead to liver cancer that subsequently will end up spreading to the remainder of your body. What all these conditions have in common is that continued alcohol consumption can lead to an increased progression up this scale. But it's important to note that up to a certain point, these conditions are reversible. When folks drink, they end up with alcohol-associated hepatitis, but if they started to become sober, their liver can improve and turn back to the way it was prior to alcohol consumption. But if you have the scar tissue or the cancer, these can only be improved with transplant or cancer therapy. So can the damage be reversed? Yes. Yes, it can, up to the point prior to cirrhosis. But let's say you get this irreversible liver damage. What does life look like? Well, it can lead to jaundice or yellowing of the eyes, buildup of fluid that can lead to infection or difficulty breathing, confusion, and then also the development of vessels within your esophagus that can lead to life-threatening bleeding. So, our questions for this poster is: what is alcohol-associated liver disease? What happens? Is it reversible? And I hope we've demonstrated what that damage looks like, what your doctor may discuss with you, and how it is reversible up to a point. Thank you.